Health experts have expressed worry over a huge gap in the health service delivery to Nigerians and the political will to implement reforms in the nation's health sector. The chairperson of the Universal Health Coverage 2023 Forum, Chief Moji Makanjuola, expressed this worry during a one-day media engagement workshop in Abuja. Chief Makanjuola also tasked the media to increase the level of awareness of the state of the nation's health sector and also help draw the attention of policymakers on the need for the political aspirants to have a transformation program for Nigeria's health sector as the nation approaches the 2023 general elections.
As a country and as a people, we are still witnessing the huge gaps in the health sector, not only in service delivery, but in policy implementation. Recent research publication of Lancet Nigeria Commission and other findings and research expressly speaks to the fact that as a nation, we need to start doing things differently, and as media practitioners too. Different such as giving health the political engine it needs to drive for sustainable improvement, create demand, ensure accountability and efficiency use of available resources. This is our drive, pushing health to the front burner of national development, taking an advantage of the political climate as we prepare for 2023.
A healthy person will be more productive, will be physically and mentally healthy, to be innovative, and also to create opportunities for development. There is no nation that can develop or grow without a healthy population. A nation that has chronically sick people cannot develop. I recall about a few months back, a very good friend of mine who was sick that needed heart surgery. A doctor in Canada identified one of the surgeons in Nigeria, somebody that we trained in this country, to come to a private hospital in Lagos to do the cardiac surgery. And today, I'm proud that the lady is walking around, ill and healthy. So it is doable. My heart bleeds most of the time when I see what is happening, because I've known the healthcare system here since 1966, when I came home from England as a medical student. And I can draw the graph. It's a downward trend, regrettably. The media can help us to reverse that. By ensuring that every political party regards health a priority and they give it the due allocation.
Today you have a headache, you are taken to the teaching hospital. You have malaria, you are taken to a teaching hospital. In fact, you run there, whereas those places are supposed to be referral centers. You refer yourself. Why is it like that? Because the primary healthcare delivery system has collapsed. That's why you no longer have working healthcare centers, primary healthcare centers in our communities. Why is it like that? Because the secondary healthcare delivery system has collapsed. The general hospitals are no longer working in our states, in our local government areas. That's why everybody now runs to Federal Medical Center. That's why people now run to National Hospital. That's why people now go to teaching hospitals. If you go there, you no longer have bed spaces, because most of the people there are supposed to be at the primary healthcare centers. Most of the people there are supposed to be at the general hospitals. But because those ones are not working, that's why those places are overpopulated.
In Nigeria, we cannot have, in each geopolitical zone, we cannot have a first-class teaching hospital. Is that impossible? Two, is it impossible that in the states, in each local government, you cannot have a state hospital that is functional? Is it impossible that in the 770-something local government that we have, we cannot have a one functional primary health care center, whereby when you have health challenge, at least you should be able to get attention at each of these levels, whether at local government, state, or the federal level. And I think this is what we need to do. If you are contesting for presidency, we want the next president to tell Nigerians what is he going to do in that level. At the level of the state governor, they should. And I believe we should hold them accountable. We hear of this situation whereby, like Moji, you see, said, we know that the amount budgeted is not really enough. But even the one budgeted, what happened to it? It's been looted at the end of the day. Ladies and gentlemen, we must all change this narrative.
Globally, there are two conditions for expanding access to healthcare and through universal health coverage. One is the mandatory participation. Health insurance must be mandatory for all of us to join. And secondly, there must be funds, pool of funds to take care of people that are not able to pay health insurance premium. So these are very, very important conditions. Unfortunately, these two important conditions were not addressed in the previous NHI's legal framework. And that's why stakeholders work with the NHIs and partners, civil society, to ensure the National Assembly prioritizes amendment of the legal framework. So in the new National Health Insurance Authority legal framework, so those two conditions are now addressed. Number one condition is the mandatory participation, ensuring that all Nigerians have a health insurance scheme and participate in one scheme or the other. And the second thing is the introduction of the Vulnerable Group Fund, which is a pool of resources meant to buy health insurance premium for the poor and the vulnerable people that are not able to buy health insurance premium. So stakeholders are cautiously optimistic that if this legal framework is well implemented, it will help us to expand health insurance, more people will be able to access care and minimize the financial hardship associated with healthcare access.